The problem is, like, if you look at Sibo directly, the recurrence rate for Sibo is 70% if that's what you do, which to me is terrible. Who wants to do something with a 70% chance that it all comes back within 6 months? So in our office, our recurrence rate is lower than 10%. And that's because we don't just stop after you do a kill phase. We do what we call the repair phase. So the most frequent path for people who have these gut dysfunction is we come in, do an exam, and we run a stool test, a very common example. We also have a blood test that looks directly at leaky gut that we really like. But let's say we run this leaky gut panel or a stool panel, and we find you have a bacterial imbalance. Or maybe you have a protozoan parasite, right? Or maybe you have yeast. You have something kind of bad in there you really shouldn't have. So we usually go through kind of what we call a removal phase or a cleaning phase where you're trying to remove some of that. We like natural products like oregano oil, berberine. Caprylic acid is the antifungal from coconut. There's some really, really good natural things that kind of help clean out some of these imbalances. So we usually go through a period of time, helping you clean out some bad stuff. But we don't want to stop there. And this is really where we kind of see a huge difference between even some of the medical colleagues is it's very standard if you were to get a gut infection that we basically just clear it out with an antibiotic, a flagyl, an anti-yeast, and then it's like, you're done. And we just kind of cross our fingers that it's all okay. The problem is, like, if you look at Sibo directly, the recurrence rate for Sibo is 70% if that's what you do, which to me is terrible. Who wants to do something with a 70% chance that it all comes back within 6 months? So in our office, our recurrence rate is lower than 10%. And that's because we don't just stop after you do a kill phase. We do what we call the repair phase. So this is where we take very, very seriously for a month or two, probiotics, gut healing things like L-glutamine or immunoglobulin or short-chain fatty acids, some of these other really, really good nutrients to help heal your gut, as well as wonderful work from my colleague, Dr. Paul. So your gut has significant connections to your brain. And I think it's been pretty well publicized how well fixing the gut can help a variety of brain fog and brain problems, particularly in children. This is a very strong avenue of research. But these things work bidirectionally. So we got this where we started to realize that I had patients who had this gut stuff just go around and around and around in circles. And we're doing enzymes and we're doing gut cleanses. And here's the thing, they work. People go, yeah, I feel better when I'm on a gut cleanse. And then it just, after I'm off for a month or two or three or four, it all comes back and I have to do another gut cleanse. And then you do another gut cleanse and it works. And they go, oh, I'm getting sick of doing gut cleanses, Dr. Warren. And this is really what we found was getting the brain online to help the gut was really key in helping people get out of this cycle of needing to rescue their gut all the time. So we really find that the neurological piece to make sure that your brain is sending the signals down through the vagus nerve, helping the gut function properly, is really key for not just getting well, but for staying well, which is what we want. If you find candida overgrowth, everyone has candida. If you find bacterial overgrowth, everyone has bacteria. So the odds of you just being able to kind of eliminate it, fix it, and then hope it doesn't come back are not in your favor. Like we said, it's about a 70% recurrence rate. So you got a 30% shot that it goes away, but we don't like those odds. And we have been able to change some of those odds by doing the neurology. It's very helpful. It's a little foreign to people, but I think Dr. Paul does a great job of drawing out the brain, drawing out the vagus nerve, how it talks to your gut. And honestly, we feel like it really fits with empowering patients because we not only want to get you better, we want your body to function better after you leave our office. And we think getting your brain to talk better to your gut is one of the best things that we can do in order to keep you healthy in the long term.
That's great. What are some of the things that people have reported when they do this complete protocol with you?
Well, so doing the complete protocol, what's interesting is there's so much functional medicine stuff that says fix the gut and you fix all this other random things. So most autoimmune protocols, inflammatory protocols have a gut clearing phase. Most brain things have a gut clearing phase. So you can really get a vast array of symptom improvement from fatigue to joint pain to brain fog, better to depression, anxiety, better as you help people improve their gut function. You also get direct gut improvements. You can get less GERD, diarrhea, constipation, more normal bowel movements, bloating, that kind of thing. Obviously better as well. So that's really what we're kind of looking for is less food reactions, better digestive health directly, but also you can see that spill over to the rest of your body and often do in many cases.
That's great.